So this is a new era. We know that lung cancer patients are really difficult to biopsy and get tissue from. So this whole stream of what we call liquid biopsies looks at DNA circulation from cancer in patients' bloods. And we know it correlates very well with when the cancer is active, when the disease is progressing. And that's well established now. So what we now need to concentrate on is the technology of picking that up in a more sensible, more selective, more efficient way, and one that doesn't cost the earth. So we heard yesterday about minimal residual disease. So this is following possibly a radical treatment, but possibly palliative treatment, which has had very good response. And we have minimal residual disease left on some radiology, perhaps a PET scan or CT. And then looking at whether the circulating DNA from cancer in patients' bloods can be followed with regards the aggressiveness or the rate of progression of these cancers, and whether we can intervene earlier to give these patients treatment, perhaps even before they become symptomatic. So the key thing is that we do not want to lose patients, and we know there's a massive attrition rate from first-line to second-line treatments with lung cancer. And you'll be very surprised to know only 40% of patients make it to second-line treatment, and that's because they become unwell very quickly. So if we can try and pick up in some other way rather than the usual clinical sort of interaction with the patient, a scientific way that can be validated, and ultimately, if we pick these patients up early, giving them earlier treatment, is that going to impact upon their overall survival and keeping their quality of life better for longer? And that's the key challenge.